And just as we mentioned earlier on, President Cyril Ramaphosa expected to address the nation any minute now. It was expected to be at 19:30, 100 hours. So let's continue with this. The South African Medical Research Council has been working to support COVID-19 research and develop a rapid response to the virus. For more on that response, as well as the importance of tracing and treatment, we're joined now via Skype by Professor Jeffrey Mphahlele, who's the Vice President for the Research at the Medical Research Council. A very good evening to you, and thank you so much for speaking to us, Mr. Mphahlele. I want to, seeing that we were talking about Africa, you say you are learning more not only about the natural history of COVID-19, but how it's affected Africa, because it's very different from the Northern Hemisphere. Tell us why.
Because we believe that the virus may behave differently in different settings. So what we have seen in other countries may not necessarily be the case in South Africa or in the African setting. So it is important to do research to investigate how the virus will behave in our setting, given that we have got a different population and a different high-risk population as well. So that's part of the reason why we are interested in doing research.
Can you just perhaps go down to the minutiae when you say a different population? What exactly are you referring to here? Genealogy, age, etc. What are you referring to?
I'm actually referring to the high-risk groups. You probably know by now that the information that we have learned from other countries have indicated that individuals who have got chronic conditions are at high risk. And we do have these individuals, but we also have our own challenges in terms of burden of disease. We have got a high burden of HIV and TB, and we have got high burden of non-communicable diseases, including persons with cardiovascular underlying conditions. So clearly, we don't know how COVID will affect these persons if they are affected.
So let's go to the research and development that you've had so far, the Alex cases that have been tracked to Limpopo. How important is this, just in terms of, obviously, there's been a comparison of studies in terms of high-density populations and the exponential growth in positive cases?
I guess the case that we know from Alexander Township is actually telling us that we need to strengthen our tracking and tracing because this is what needs to be done to make sure that we are able to trace all people who have got contact with infected individuals. So you asked earlier what kind of research we are doing to try and help with the tracking and the tracing. And indeed, we are funding research that will be able to give us solutions in terms of community tracking and tracing. It's not going to be easy in all the settings, as you can imagine, that we also have informal settlements in South Africa. So a very good scenario is actually a case in Alexander Township. If we have got more of these cases in the township, will we be able to track and trace all these cases? At the moment, we hope so, but it's not going to go without any challenges.
I want to talk about the people who are most vulnerable that you mentioned earlier on, those with pre-existing cases such as HIV, TB, pregnant women. But because this is respiratory diseases, the health department has also mentioned smokers. Tell us why this is significant.
Smoking is significant because smokers, especially heavy smokers, eventually, if you're a heavy smoker, you have got a problem with lung conditions. because this is a respiratory infection. It will, in severe and critical cases, affect the lungs. And if you are a heavy smoker, obviously, this will be a big problem. And it has been shown in China that in men, they tend to experience higher mortality. And one of the explanation was that most probably is because men smoke more than women. That's why you experience higher mortality. But generally, smoking is being discouraged, as you have heard from WHO and also from the Department of Health, because if you are a heavy smoker, certainly this will put you at risk for acquiring COVID infection.
So you've also said that there is an urgent need to describe the epidemiology of COVID-19 in South Africa, as well as addressing the diagnostic and therapeutic host of viral factors. Expand a little bit more on this.
In terms of epidemiology, it's important that we understand the risk factors for acquiring this infection in our own setting. So that we can design locally relevant public health measures. So when we talk about epidemiology, we talk about understanding people who are at high risk. Those that we are concerned about may not necessarily be the only groups that are high risk, are at high risk, I beg your pardon. So by doing surveillance, we will be able to identify additional groups that are at higher risk for acquiring infection. So that's the importance of epidemiology. But it is also important that epidemiology will provide us with solutions in terms of public health measures. Because if we don't understand the extent of the problem, we won't be able to provide appropriate public health measure. And it goes with detection of the virus, that at the moment, the detection is literally based on people who have got symptomatic infection. And you know, the methodology that is being used is to look for active infection in the sample. And we don't know those who might have been exposed and not necessarily presenting with symptoms, the so-called asymptomatic cases. We don't know the extent of the problem in this group. And we know that they are there. And the danger is that it does not necessarily mean that if you are asymptomatic, you are not passing the virus to those who are vulnerable. So you can be asymptomatic and still continue to shed the virus.
Okay,
so all these are important in terms of epidemiology.
All right, thank you very much. There's Professor Jeffrey Mphahlele, who is the Vice President for Research at the South African Medical Research Council. A very important interview to just get a sense, the context of what exactly we're dealing with, especially within these times. President Cyril Ramaphosa is expected to speak any moment now, especially around these issues and how exactly we're doing as a country day 4 of lockdown. Let's quickly remind you of news headlines.